As a patient, you will present at the phlebotomy area for registration. Be sure to bring your insurance card with you for the correct process for patient identification to be followed. The receptionist will check the hospital information system for the doctor's orders. These will be activated to generate the labels for the blood tubes. You will be given a waiting queue number and will be instructed to take a seat and wait for your number to be called by the phlebotomist. As soon as the phlebotomy procedure on the previous patient has been completed and the blood draw cubicle has been prepared, your number will be called. Upon entering the cubicle, you will be greeted by the phlebotomist. You will be positively identified and the procedure explained to you. If you consent, then the phlebotomy procedure will commence. Latex-free gloves form a part of the personal protective equipment that is required to be used. The gloves need to be free of latex, as this substance can cause allergic reactions. Safety engineered single-use needles are used for the protection of both the patient and phlebotomist. The safety needles help to prevent potentially dangerous needle stick injuries. The disposable plastic tube holder is to hold the vacutainer tube in place. It is very important to use the correct disinfectant on the phlebotomy site. Presently, use is made of a 70% alcohol swab. The clean gauze pad is used for covering the puncture site post-procedure. The tape is used to secure the gauze pad after the procedure is totally completed. The latex-free rubber tourniquet is disposable, as single use is recommended. The vacutainer tubes that the blood is collected in have different additives to either prevent clotting or enhance the clotting process. The types of vacutainers used will be according to the test orders that your physician has requested. This is a plastic biohazard bag used for transportation of samples. The red waste bin is used to dispose of contaminated or biohazardous waste. This container is specially designed for disposal of used, sharp objects, such as needles. After washing or sanitizing her hands, the phlebotomist dons clean gloves, taking care not to contaminate them at all. The phlebotomist needs to choose the correct glove size, otherwise if too small or too large, it could interfere with the procedure. The tourniquet is tied 10 to 15 centimeters above the phlebotomy site in a manner to accommodate single-handed release when necessary. This helps the veins to be palpated. Care should be taken to tie the tourniquet that it is not too loose or too tight. The patient is requested to open and close the fist, which accommodates the veins to become more visible. The tourniquet may only be left on the arm for 1 minute once the procedure begins. The phlebotomist will examine the arm for a suitable vein in the antecubital area. If there is not a suitable vein on the first arm, then the second arm will be examined. If there is no vein suitable on either arm, the back of the hand will be examined and perhaps used. The disinfecting process is performed by using the alcohol swab in a circular motion from the inside outwards in the selected area. Care should be taken not to touch the disinfected area again. If necessary to retouch this area, swab again. Allow the area to dry well before introducing the needle. The needles are stored in sterile packs and are disposable. A safety sheath covers the needle to maintain its sterility and to prevent any needle stick to the phlebotomist. The phlebotomist carefully opens the needle pack and removes it, checking visibly that all is intact. The vacutainer holder is then taken and the tubing is connected via a lure adapter. The needle sheath is removed. The phlebotomist then introduces the needle into the vein, making sure that the angle of entry is between 15 and 30 degrees. This will accommodate the blood to flow easily into the needle and then pass through the tubing into the vacutainer, which holds the blood. The patient is requested to release the fist once the blood is flowing freely. The tourniquet is released within 1 minute and before the needle is removed from the vein. A gauze pad is placed over the entry point of the needle and the phlebotomist then pulls the needle gently back out of the vein. As the needle is pulled out of the vein, it is retracted into a covering sheath that locks into place, preventing any further use of the needle. This is the safety feature of this needle. Once the oozing of blood has ceased, plaster is applied to keep the gauze in place. Pressure on the puncture site causes the platelets to immediately aggregate at the puncture site, forming a plug to ensure the formation of a fibrin clot, which will prevent a hematoma forming. The used needle is immediately disposed of in the sharps container. The tube of blood is gently mixed to activate the anticoagulant or additive. The collector's identification number and the time of draw is written on the patient's label. This label is then placed on the tube of blood in the presence of the patient. The labeled blood is then placed into a plastic biohazardous bag and sealed. It is important that the blood is transported in a sealed bag to prevent any blood spills or contamination to the environment. The puncture site is examined prior to the patient leaving. Once the patient has been thanked and released, the phlebotomist disposes of the used gloves. And then passes the sample on to be registered in the laboratory information system before being analyzed in the laboratory.